Well, hello, everyone. I think we're going to go ahead and just get started because it's right at noon. And I'm Beth Rose. I'm one of the co-founders and a board member at AKEDA. And today's ECHO offers a forum for interdisciplinary healthcare professionals to connect with eating disorder experts and each other. This program includes a didactic presentation, time for questions and answers, and a case presentation. The series has been guided by a hub team of professionals in the field. They'll introduce themselves in the chat. We couldn't do this ECHO without the generous financial support of ConocoPhillips. Thanks for their support. We can offer this world-class educational event at no charge to participants. You may claim 1 credit hour of continuing education if you attend at least 90% of today's live session. A link will be provided at the end of the session to complete the evaluation and download your certificate. A few Zoom reminders: closed captions are automatically generated and accessed by pressing the CC button at the bottom of your screen. If you're able, please keep your camera on and your mic muted unless you are asking a question. And we do encourage questions. So use the chat box at any time and we'll try to answer as many questions as possible. Finally, please know that the opinions of the hub team and presenters are their own and do not necessarily represent those of AKEDA or any ECHO sponsors. Additionally, Project ECHO is not HIPAA compliant, and therefore no protected health information is to be shared or displayed at any time. Thank you to everyone for following these guidelines. We acknowledge that we are hosting this session from Anchorage on the unceded lands of the Dena'ina people who have lived on these unceded lands for thousands of years. We thank the Dena'ina people for their stewardship of the lands, water, air, and all life that sustains us. We respect the Dena'ina cultural ways and their homelands and shall strive to be good neighbors. We recognize that in Alaska, there will always be Indigenous land and pledge to work with Indigenous communities with an intent to listen, learn, and collaborate in a respectful manner. And now on to our program. Our didactic presentation today is by Katie Bell, LPC and licensed mental health counselor. And Katie Bell is the owner and founder of Making Space, a therapeutic community and art therapy, AKLLC. She's a licensed professional counselor, board-approved supervisor, registered art therapist, certified child and adolescent anxiety treatment specialist, and level 3 TBTS eating disorder provider. She works with ages 12 through adults and specializes in treating anxiety disorders, ADHD, and eating disorders. In addition to individual therapy, she offers workshops, groups, and community events. And sorry, I'm just lost myself here. Community events to educate others and expand access to the healing power of the arts and psychotherapy. And now I'd like to pass this over to you, Katie.
Thank you so much. Give me 1 second here and I'll get my screen up. All right, welcome to an interconnected approach to body image. I don't have any conflicts to disclose. I was a previous board member of AKEDA. And today we have quite a few objectives to roll through. We're going to define the 4 core elements of body image formation, define body image disturbance, name correlations between body image and eating disorders, and also explore several interventions to an interconnected and whole body approach to working with body image and eating disorders. So kind of a lot. We're going to just blast through it. So hang on. Before we get started, I want to introduce a client to just keep in mind. This client is named Rose. Rose is in her mid-40s. She's a white cishet female, and she continues to struggle with body image and feeling distressed about body, despite having years with no active eating disorder symptoms. So a little bit about Rose's background. She had an uncomplicated pregnancy and birth, but as an infant, she was described as difficult to soothe and would often get stiff as a board. She was a very, very small child, so kind of went back and forth between the third and fifth percentile in growth and development, easily overwhelmed and unable to articulate the sense of overwhelm. So noises were too loud, touch was too intense. As she got older, she started to have difficulty forming friendships, and was often described as rigid, intense, or picky by others. She had upset GI issues, difficulty digesting foods, often resulting in smelly gas, which was embarrassing and painful. She also developed severe acne in high school. Rose experienced some difficult family things around sixth grade, including substance abuse, marital tension, some moves. And also around the same time, she started to get really into cross country and track and became a highly competitive athlete. She also developed anorexia about this time, was eventually hospitalized at the age of 15, and then achieved weight restoration at 19. So again, she eliminated most eating disorder behaviors in adulthood. At another point, she realized she began eliminating gluten from her diet and found that this relieved some of her symptoms and actually led to a celiac disease diagnosis. And then continued to pursue endurance sports through adulthood. So keep kind of this character in mind as we talk about the foundation and the development of body image. What is it? Where does it come from? And what do we do about it? So if we're going to hope to understand body image, we have to be willing to understand the experience of the whole body. This message really, I think, captures the heart of an interconnected approach to understanding and healing body image and the pathologies. And this presentation, like I said, is sort of a lightning round looking at the 4 domains of body image, which include our neurobiological, behavioral, personal, psychological, and then social systemic. Body image disturbance is one of the most important psychopathological characteristics of eating disorders. It's a key factor in predicting treatment effectiveness, relapse, and the development of eating disorder symptoms in subclinical populations. That means in people who do not yet have eating disorders. A couple other things to keep in mind related to body image and eating disorders, that even when eating disorder behaviors improve, perception of one's body as defective and flawed may continue. Body image disturbance is one of the last clinical features often to remit during the recovery process. And as the Hamada research suggests, unchecked body image disturbance produces eating disorder behaviors in non-eating disorder patients. This makes body image disturbance both predictive and pervasive. In other words, it is highly, highly important in the recovery process from an eating disorder. So what is body image anyway, right? Most folks would really be able to describe some version of this first definition: the perceptions, thoughts, feelings, and behaviors related to body image experience. This definition really focuses on our cognitive experience of body image, that is the story we tell ourselves, and the degree of impact that story has. The body image journal expands it a little bit more, almost operationalizing it, which is nice. So I like the second definition. I know it's kind of long, but it does give us a little bit of a closer look at this difference between the physical appearance as an important aspect of body image, but also embodiment. So how we're engaging with the body in the world, and focusing on and appreciating body functionality as other elements of it. But even these definitions kind of miss out on that neurobiological and behavioral part of the foundation of the development of body image. So body image in our brain, body self-consciousness is a term that probably occupational therapists and physical therapists are a little bit more familiar. It's essentially describing the process by which we become conscious that we have a body and that our body is ours. So it's divided into these 4 kind of categories that we experience developmentally. So they build on one another. So the first one is self-location, the experience of occupying volume of space. The next is body ownership, the experience of owning a body, right? So this body is mine. Agency, the sense of being in control of one's own body movements. And that first person perspective, the ability to see the world through the view of self. So I am in a body and I'm experiencing the world through my body. So body self-consciousness creates an actual neurological map of our body in relationship to the world around us in our brain. So it is represented in different brain structures and neural networks within the brain and body. And these neural networks relay information back and forth and interact with other neural networks and brain structures, like our visual, cortex, our auditory cortex. These areas are part of that brain-body mapping. Right. A really fun example, I think, of the development of this process in action is watching like a newborn baby wave their hand in front of their face. If you've ever seen this, oftentimes the baby is like startled. It's like, where did this thing come from? Right. It has not yet experienced self-location, right? The baby doesn't recognize that it is occupying a body and that it owns its body and that it has agency over its body. And eventually, as we grow really quickly, we learn to run and play. And now all of a sudden we understand that we have a body in the world and that the body is ours and that we are our body. And so this is that developmental process called body self-consciousness that is a foundation of what we later call body image. So as we continue to develop, we have some additional experiences then that add to this interconnected body-brain self-image. So our autobiographical self is based on memories important to who we are, and develop the foundation of the narrative of body. So it's through our body we experience life and have these memories. And memories are again stored in various regions of the brain depending on the nature of the memory, and involved in a variety of neural networks, both in encoding those memories and then accessing those memories. The social self is how we perceive ourselves in relation to others. And the social self formation is also really interesting because, again, it involves different parts of the brain and different networks than how we think about ourselves just as me. So a really good example of this is we can look through fMRI studies and different types of brain imaging. We can recognize that the part of the brain that's activated when I think thoughts about myself is different than the part of the brain that's activated when I think about how others are thinking about me, right? So two different areas of the brain. We also have the embodied self, which is a way of thinking about our current interrelationship between bodies. So embodied self is that our sensory, both internal, right, and external sensory. And this embodied self is connected to a concept called embodied cognition. So I know I'm throwing a lot of stuff at you. These are all terms that would be probably helpful for you to maybe take some time to look into in more depth. But embodied cognition is the recognition that our thoughts, our cognition, and in fact, our cognitive processing strategies are shaped by the state and action of the body. So there's this really intricate link between our motor development, motor skills, experience in our surroundings, and how we think, what we think, all right? So one last piece of the puzzle of the development of body image, you can see how all of these are beginning to sort of layer on each other, is the concept of intersectionality. So think systems plus self, right? So intersectionality is defined as the complex cumulative way in which the effects of multiple forms of discrimination, such as racism, sexism, and classism, combine, overlap, or intersect. I think that the poet, queer Black feminist, social justice advocate, Audre Lorde. I love this quote because I think it really captures the human experience and why working with body image can be so complicated, right? Because there is no such thing as a single issue struggle because we do not live single issue lives. I think that really captures it. Then I have another intersectionality of identity, which goes on a little bit to just look at this concept of the self as this ever-changing crossroads or convergence, right? This coming together of who we are, which change personally, contextually, and developmentally over time. So this little cartoon image, here we have, this person in a wheelchair, looking at a set of stairs, right? Their body sensation is going to be different, their response. And to this environmental cue is going to be different. And all of that is going to combine to help inform their body image, right? Intersectionality, really understanding this, is a psychological model rooted in the blood, sweat, and tears of social justice reformers, feminist scholars, and Indigenous teachers. It helps us to understand the impact that structured systems have on the development of our bodies, and therefore body image, within the context of policy, law, opportunity, oppression, size, medical status, age, ability, and experience. So these are not separate parts of self, but really, again, how it all comes together and intersects in a reciprocal way. So this next slide is just another way of visualizing that, right? Really thinking about how body image is these layers of interactive relationships, each different element exacting influence on the other and changing our sensory and perceptual experience, resulting in a formation, right? That's how we make sense of the world, of a story, right? To try and explain what and why it is like this to be in this body, right? So if we had a little bit more time, I'd encourage you all to take a moment to write down the experiences of life, which converge to take the form and the shape of you. And so maybe be thinking about this as well. All right. So now we've arrived. When we combine all of these elements, we get a complex and accurate understanding of body image, to include the reciprocal relationship between psychological self and experiences that affect and inform other bodily systems in a constant state of recalibration. So I want you to keep this word in your mind, recalibration. I like this kind of video image because it's that back and forth, that efferent and afferent reaction within the system between the brain, the body, and then also the environment. If all goes well, our system continues to kind of update and recalibrate to understand who we are and how we are in the world, right? But sometimes it doesn't go well, and this is where body image disturbance comes in, right? So body image disturbance is, remember, a key predictive factor. So it's described as the perceptual disturbance, right? So that's how we're both seeing and interpreting that information in one's size and shape, and affective, so that's our emotional states, right? In attitudes and feelings towards the body. And this is really critical, the subsequent level of importance of one's ability or inability to be congruent with ideal body or expectation. So disturbance in any of the four foundations of body image then can result in body image disturbance. Let's see, we have that neurological, behavioral, personal, psychological, social, and systemic. This is kind of a complicated slide, and I wish we could spend a little bit more time on it. But this is from a research paper called Out of My Real Body, Cognitive Neuroscience Meets Eating Disorders, by Giuseppe Riva. And it offers a model to explore the complex relationship between body image formation and body image disturbance. So here you can see how different combinations of impairments or differences yield different types of body image associated experiences. So if you look over to all the way to the right on the slide, it looks at the body disorders is how they're labeled. So phantom limb, for example, displays a neurological disturbance in our body occupying space experience. Remember, that's part of that body self-consciousness, neural development. Whereas xenomelia is a disturbance in body ownership and in the self-social body. So xenomelia is that non-acceptance of one's own extremities, resulting in the desire for elective limb amputation or paralysis, right? This body is not mine. And then all the way down at the bottom, we have that body dysmorphia. Now, not everyone, of course, who has a disruption in body mapping or body image on this neurological level necessarily has body image, body dysmorphia, or the level of body image distress is associated with eating disorders. And so there's a couple other final factors in that play into that. So one is that disproportionate or overimportance of body image or hyperfixation on body. that in and of itself is a complex social and neurological experience. So we're going to look at a couple of research studies that expand that a little bit. Okay, so let me explain this slide a little bit. Our internal body image, right, should be constantly updating to help us adapt and move through the world around us. But we have evidence on that previous slide that there's a lot of reasons why that doesn't happen. And in those with eating disorders or body dysmorphia, there's one theory that says there's an error in this updating process. So there's an overemphasis on some system updates and an underemphasis on other system updates. There's some other explanations too. So a study with anorexia nervosa clients with perceptual disturbances, so again, that's that interpretation of the image as they see it, was associated with image perception that was derived from greater activation of the emotional neural networks and a suppressed or lower activation of that visual processing regions during tasks related to body image, size estimation, and perception. So if you look, we have the little healthy little person over on the left, plus a mirror, plus lots of emotions, minus that visual processing center. And I did this before Halloween, so we have our zombie, right? But that distorted, disturbed image. The brain differences may exist before the onset of anorexia, we know it is exacerbated by the starvation experience, or come later. So the second little equation we have at the bottom is representative of the Minnesota starvation experiment, where it was displayed that the onset of body image issues, fixations, and obsessional behaviors around body and food previously did not exist until they participated in this experience. And this data provided fodder for further research in understanding the action of obsessive behaviors, which also alter our brain and therefore our perception of body. So we have our little person. Now that little person is stuck in a maze, right? Repetitive behaviors, restricted access, so starvation of the brain, and we get kind of the same result, which is this disturbance in the ability to accurately perceive the self and an overemphasis or hyperfixation on level of importance. Thomas Cash is a researcher, done a lot of research on body image. And he talks a lot about it's not the degree of positivity or negativity necessarily that determines poor body image. So whether I like my body or I hate my body, but rather the pairing, so the coming together of a negative feelings about self, so that affective state, and high level of importance of body. That creates the cognitive fuel for pervasive and impactful body image disturbances. So a lot of times, people will ask, well, is it about, positive body or body neutrality? And really the data suggests that it doesn't actually matter. That part is whatever you can get to is fantastic. Really needing to look at shifting that level of importance, kind of uncoupling this negative affective state, which we know is based in bodily experience as well, and how important that is. So another study that I think highlights this really well was a qualitative study done with non-binary and gender fluid folks that looked at neither positive or negative evaluation of body as a degree of difference from some identified norm. So what that means is a lot of the studies on traditional eating disorder clients, so AN, bulimia, that for example, look at degree of difference from ideal body image on a thinness scale. And so what this study looked at and what they realized is there isn't an agreed upon norm for ideal gender nonconforming, gender fluid body, right? And so what made the difference in that level of distress, body image disturbance, and eating disorder symptom expression was the degree of difference from their, the degree of importance in their own perceived difference between perceived self and desired self, plus the interactions with others. So again, think social self and systemic self, like we were talking about, that determine the dysmorphic pathology and then associated eating disorder behaviors. So this expansion of understanding all of these interconnections, right, also creates space for understanding body image disturbance and eating disorder behaviors that are not a direct response to thinness. For example, muscle dysphoria or body image disturbance related to other experiences, right? So this understanding allows us to decentralize. That's when we move focus away from single person issue or single identity issue. So this issue is not in the ego, but rather in the all, right? It's multivariate, which means the resolution is also multivariate. When we can move away from, as providers, this fixation, and as a client, this fixation on that stuck cognitive story of self, right? I hate my body, for example, and rather into an embodied self or understanding the social self, the systemic self, right? We have a lot more tools to be able to work with. So the embodied intersexual developmental neurological understanding of body expands our options, right? It opens doors to working with our clients. So what can we do? On this slide, I would really start with looking first, regardless of whether you're a nurse or a dietitian or a physician or a therapist, doesn't matter your role, we can all start with looking at the sociocultural. So first, unpacking intersectionality on body image, racism, sizeism, ableism, really understanding how that affects your clients, but even more important, how that affects you as a provider. So get your own story figured out and understand that. And second, the thing that we can all do regardless of our profession is we can make our practice a safe space for all people, regardless of race, size, ability, any of that. All right. So those are like number one things. Models of interconnectivity help us to understand, again, these four domains, that neurological, behavioral, psychological, and then intersectional. So somatic body, how can we help our clients learn to be in the body? Maybe this requires an occupational therapy referral, right? Looking at the somatic therapies, body mindfulness, visual expressions of the body map. And there's a book, Practices for Embodied Living, that is good. Second one, behavioral disrupt and tolerate. These are going to be your behavioral therapies, exposure response prevention, mirror exposure techniques, those sorts of things that are going to disrupt those behaviors that rewire the brain that contribute to obsessions around body. So we need to disrupt and tolerate that. And then we have the psychological or the personal story, which where traditionally this is where a lot of effort is. And this is only one of the four areas we really need to be looking at, which is unpacking that story of self. So there's some resources there for you. So now we come back to Rose as we kind of finish up. When I described the interconnected model of body image to Rose, she stated, "This brings me to tears. It just feels so right." Her disturbance of body image was a result of years of undiagnosed sensory and medical needs, which put her at odds with her body and unable to find a way to have a peaceful relationship with it. Obsession with thinness gave her language to explore and express her ongoing difficult relationship. It was reinforced culturally, and the physical effects of starvation blunted the intense way she typically experienced the world, and increased repetitive behaviors continued to hardwire the disturbance in her brain. The highly competitive nature of running was a perfect personality fit and gave her tools to alter her body state in a way that she had never been able to access before. Low early childhood growth rates likely altered body self-consciousness and updating forms of neural body maps, which slowed her rate of change. The interconnected model allowed her to shift the narrative from "my body is wrong and I need to change it" to "my body is overwhelming and I need to understand it." All right, thank you so much.
Thank you, Katie. That was a great presentation. We have so much conversation about body image, but really don't get to the nuts and bolts of this. And you really went into depth on this. So that was really very helpful. And I know that one of our subtitles for this conversation was that, that providers are dealing with body image, but may not know how to approach it. So the subtitle was why it's important and why it's difficult and still important to do this anyway. So I would like to open this up to questions and comments. And you can do this in the chat, or you can raise your hand. And remember, there's no such thing as a dumb question. If you'd like to raise your hand, just please unmute yourself, and then we can engage you in a dialogue. So let's open it up and see how this might fit into your practice and what questions you might have about working with patients with body image issues. While we're waiting for folks, I actually have one question. I thought it was very interesting that you said that the body positivity or body neutrality movement wasn't found to be statistically helpful. But can you talk a little bit about that? And I think you talked about the congruence with the acceptance of the body that one has. So if you could talk about that a bit.
Yeah, that's a good question. So it's not that the movements weren't helpful. They were really helpful in providing tools to kind of change the story. But that one of the questions I get a lot from clients is, do I have to love my body? Do I have to feel positive about it? And the answer, the data is really clear. It says, no, you don't, right? What we do need to look at is understanding what are all the elements in an individual's life that have created the experience of body to be so important, and that have shifted their perceptual understanding of body. So when we begin to kind of untangle that, the positivity or negativity becomes secondary to really understanding just the importance of body and the story of body, which developed the feelings around body.
Great, thank you. We have a question from Dr. Yolanda Evans, who's a medical provider, and she asks, do you have tips to introduce the different parts of our brain that impact body image? Also, wondering how to choose a therapeutic modality to start with in addressing body image.
That's a really good question. Well, therapeutic modality, I always encourage you to think about what aligns with your scope of practice, with your personality, what works for you, and being able to refer out for other things and also look at community activities. So, in my practice, I'm a art therapist as well, and a somatically trained art therapist, which is like a sub part of that. And so in that, we're already doing a lot of movement and behavioral changes and somatic work. And so that is kind of an easy thing to wrap in. But if you didn't have that, then being able to refer out to somebody or just encourage, your clients to access, there are trauma-informed or eating disorder-informed body work providers that can help clients kind of get in contact with the sensation of body. So that's kind of one. So I guess short answer is know yourself, what aligns with you, and start there, and then refer out for all else. In terms of understanding the different parts of our brain that impact body image, I think I'd really start with that sense of that the basic understanding of body self-consciousness, and introducing clients, to things like the vestibular system, and understanding how proprioception works, and some of those ideas of like our very big block, how we process sensory information in the world is a really helpful way, because it helps people connect to the active role of body, that my body is experiencing the world. It's not my thoughts experiencing the world, it's my body. Yeah, so there's that.
Thank you. And we have this question about, what are your suggestions when working with youth who have been bullied in the form of body shaming?
Yeah, I think compassion, and helping them tell their story of what that experience has been like, and what it might feel like in their body to feel proud of their body. So that's other language you can begin to shift. And I think also helping to name, understanding bullying in general, and helping to name some of those systemic pieces. So really leaning into learning more about intersectionality and the influences there.
Great. And we have time for just these last two questions, probably with some brief answers, but any recommendations for how to respond to using these models when someone say, I can't eat because I know I'm fat? What words are helpful to use?
Oh yeah, that's a really, really good one. I think if folks were present for last week's presentation with Dr. Wassenaar, she had talked about eating as an action of trauma recovery, right? So some basic education on how metabolism actually works. So learning about that is really helpful, and just that reminder of the inherent value and worth of each human being. But the job is not necessarily to convince somebody to like themselves, but to help them understand the experience of being themselves.
Great, thank you. And then just last, do you have a recommendation of where to learn more about development of body image, stages, body image disturbance, books and CEUs? And I will say, Katie, this would be helpful for you. And then I'll also welcome others in this all teach, all learn kind of modality of if others have some great suggestions too, to please add that to the chat.
Yeah, the development of body image stages, man, the body image journal can actually be accessed free online through the National Institute of Health. And that is, I mean, that's going to be like your direct source material, right? Looking at all of the research that has basically been published today on body image work, and that is globally. So it includes neuroscience as well as sociology and psychology. And so that's a really fantastic resource to look into. There's also Thomas Cash's body image workbook, and I think he has an updated version of that, which is good. And again, he comes at it from a cognitive behavioral therapy approach. I really like The Body is Not an Apology by Sonia Renee Taylor. That's going to be that interconnected intersectionality model, looking at all these different levels. And then I think on this slides I have, oh my gosh, I forgot what it's called. And Hillary McBride is the author. Tools for Embodied Living. That's what it's called. And that's a book, and there's also a workbook. So that kind of gets you some of those basic, some of those, in those four domains of being able to work with.
Thank you so much. This was such a great presentation, and there's some really great questions too. But now we're going to wrap this one up and move over to our case presentation. And I'd like to pass this over to Dr. Yolanda Evans to introduce our case presentation.